Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and my wonderful wife is running the pharmacy right now. We already did a podcast earlier, and we're doing another one. I am super excited to have Bryce Eddy on our podcast. He is somebody that doesn't believe in being mediocre or normal, and I like that because it sounds a lot like me. So he has his own podcast also, and I think I'm going to be on that here shortly. So Bryce, welcome to our show.
Appreciate it.
Yes. So I had the pleasure of meeting you at Old State Saloon in Eagle, Idaho a few weeks back, and I had a pleasure of watching you speak, and so glad that it just happened that I was in town at the time you're going to speak. So one of the things you talked about a little bit, and I asked some questions too, was about healthcare, and particularly government healthcare, because you, like me, love the government just as much as I do, right?
Yeah, that's right. That's right. Yeah.
So it was interesting listen to some of your answer, because it really goes along the lines of my book, and my book's called Sickened: How the Government Ruined Healthcare and How to Fix It. And I do believe that the government did ruin. If people believe that our healthcare is bad, which I do, although there's an alternative to government healthcare, then and 75 to 80% of it is paid by the government, then you can blame the government for ruining it. So the cool thing is there are other options. So tell us, how do we liberate ourselves from government healthcare?
Yeah, well, it's interesting. So, I mean, this is an area of expertise of mine because, although, yeah, I've been doing this podcast for a few years now, and been on the forefront of some things politically, and sort of engaged in this battle, and have other businesses and other things that I've done for many years. But I come from the health insurance space. So,
oh wow, I didn't know that.
Yeah, so I started out, my career in sales, selling health insurance and selling insurance in general, and all corporate focused stuff. And so I kind of made my way, made my wealth. We, sold a big insurance firm where I was a partner. And so, I got to experience all that, and also got to be incredibly jaded by what I witnessed. So, I noticed that there was essentially a lack of, being able to really truly be an entrepreneur in that space, because I thought, hey, listen, I can solve this. Healthcare costs are going out of control. Well, let's just shift the paradigm a little bit. And why don't we have actual insurance? Because we don't have health insurance here in the United States. What we have are health assistance plans. You cannot insure against what occurs and reoccurs on a regular basis, right? It's against the actual law or nature of insurance, and so we have this idea that we also have privatized healthcare here in the United States, and we don't really also. So, everybody, and they do this with regards to politics. They argue that capitalism is terrible. Capitalism doesn't work. Look at the evidence of this. Look at all this corruption. And so they'll argue against it, and they will, on one side, they'll give you this imagined beautiful utopia of socialism, right? Which is completely manufactured out of their own fantasies. And then they'll compare it to corruption over here, and they'll say that they're comparing realities. Well, it's not a reality over here, and it's not a reality over here. We don't really have a free market system here in the U.S. with many things, really. And that's why we have so much corruption. That's why we have so much government interference and involvement. That's why things are out of control and expensive and all that stuff. Well, the same thing with healthcare. And so they'll argue with the idea of socialized medicine, right? Single payer health is, one of the euphemisms that they also use. They'll argue about that, but and say that, well, that's a lot better than what we have over here. Well, in some respects, almost anything's better than what we have here, because we do have the worst of both worlds. You have this corrupt capitalist system with the world's biggest bureaucracy jumped on top of it, and that's the federal government. And they doubled down when it came to ACA, and they even exacerbated the problem more. So I look at all of that and I realized, years ago, okay, hey, I can fix it. Let's return to real insurance principles. Let's return to a real free market style system. And I spent a whole bunch of money out of my own pocket and, went down this path and did some modeling with, really smart underwriters and actuaries, and came up with something that at the time, the rates for family insurance would have been in the couple $1,000s a month. And now it's way higher than that. And I brought the cost down to a couple $100s a month. And again, it was using real insurance and using, first dollar coverage for things, and, basically single party pay, which is you are responsible for certain things about your health. And we were, contracting directly with doctors, and we were going to do this thing. And the truth is that it became illegal for you to buy and illegal for me to sell. So do we really have a free market system where we can really use capitalism to our advantage and really come up with something that people want to buy, and people would want to buy this? And so, you realize that you can't do that. And then you start to kind of like your mind folds open and you see how corrupt our whole system is. And then, we can, if we want, get into the idea of what's happening in other countries being much better, because it's not. But anyway, so I kind of got red pilled early on with all of this stuff. So there you have it.
Awesome. I didn't know you had a background in insurance. That's interesting. And well, I will tell you, one thing, just like you're talking about, in socialized medicine or in our insurance medicine in the United States, it's not a free market.
No.
So that's why service sucks. That's why quality sucks. That's why it's expensive. And people will say, well, but wait a minute, I've got Premier Blue Cross, or I've got United Healthcare. I don't have government insurance. Oh, let me tell you, it's so highly regulated, it's government insurance.
Yeah.
Because through the ACA, like they're told what to pay for and what price to pay it at. There is no free market whatsoever in traditional insurance. Now, here's what I will say, and here's what I talk about in my book. Here's what my wife and I do. Here's what we tell patients to do. If you want to be liberated from that system, you don't have traditional insurance. You have a health sharing ministry or a health sharing account.
Which ironically, and it drives me nuts. So you'll hear MetaShare and some of those in their commercials, and this is because they have to, right? But you'll hear them say that now this is not insurance, but yet it is expressly insurance. It's actually it actually fits the definition of real insurance.
Right. Well, I'm assuming the reason they can't say that, Bryce, is because it's a legality from the government.
Yeah, no, it's a regulatory issue. I just find it. I just laugh every time I hear it, because I'm like, actually, it is. But
right. And here's I'd like to hear your opinion about this, because the naysayers with the health sharing ministries, they'll say, oh, I'd never trust a health insurance a health sharing ministry to pay my medical bills, and I would much rather trust an insurance company because they're regulated by the government. I'm like, seriously? I've worked on both sides of health insurance. As a patient and as a provider, I would never trust them at all.
Yeah.
To pay anything. And let's remember this, Bryce, 50% of all bankruptcies that are filed on healthcare bills, over 50% of those people had insurance.
Yeah. And no, it's a complete mess, and it's a broken system. And I, sit down with clients still to this day, and I tell them that, we're witnessing, not the collapse of you heard my speech the other day. We're witnessing the collapse of a lot of things, including our republic. But health care has collapsed in the United States, and that's why people are seeing that their bills aren't getting paid, or they're having trouble accessing care. I mean, that it's getting harder and harder to access care now because the system is so broken. Again, they've doubled down on all of the worst ideas and all of the worst policies on the planet. And then, of course, it isn't also insurance at all, because it's not being really underwritten, right? Nobody, people are digging their graves with their spoons, and they are making terrible decisions on a daily basis for them. and yet they don't pay any more than the person who is engaged in that system, who is making really tough decisions on a daily basis to keep themselves healthy, and they're eliminating the crap from their household pantries, and all of the those sort of things, and so there is no penalty for you being morbidly obese and things like that within our current system. And so all of that stuff serves to really exasperate the issues that we're facing.
Yeah. You probably Mark Levin, right? I'm sure.
Mhm. Sure.
Yeah. So I remember one time Mark Levin talking about when the ACA was trying to go through in 2008ish or whatever, and they were talking about the pre-existing condition and how insurance companies couldn't charge extra for pre-existing conditions and blah 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 blah. And he used the analogy, just like you're talking about the obese person. And I love obese people, but that's why I love people. That's why I talk about obesity being the most dangerous thing you can do as an
Yeah.
American, because I love them. I don't want them to die early from
Yeah. No, I care
cardiovascular
about them
disease.
for sure.
Right. So he mentioned this. He says, not being able to charge more for pre-existing condition in healthcare would be like buying fire insurance on your house when it's on fire.
Yeah.
Think about that. I mean, and it really is, and that's one of the reasons, people like you and I that are healthy literally are. And if I was going to have traditional health insurance, I'd want the biggest deductible I could have,
Yeah.
um, because my risk is very small from having. I want the big catastrophic event to be covered. So literally, like you're saying, my premiums a month should be like $50 a month. I don't want pharmacy coverage. I don't want doctor coverage. I want the big heart attack coverage or whatever. Although I don't think I'm going to have a heart attack because I'm
Yeah.
going to prevent that. But literally, it should be, whereas insuring an obese person with diabetes and all that is like insuring a drunk driver, not for a car and not charging them more. That's not fair at all to the person like me that's a safe driver.
Yeah, no, it's exactly right. And there are people that are doing some things that I think are creative out there. The health sharing ministries are one. The direct primary care model,
I love it.
which is another. One of my friends owns Appleton Clinics. They actually have a location here in Idaho, and the rest of them I think are in Colorado. But you pay a fraction of the cost. You have more access to a doctor, and it doesn't have that sort of catastrophic layer on top, which you could take care of through more traditional insurance means. Like
Right.
hit by a bus insurance. But then have to to keep those rates low, just like life insurance or any other thing. Have to live a good lifestyle, have to hit certain biomarkers. There are people that are going to get, struck by lightning type diagnoses, sudden cancer, different things that are going to happen. That's part of life, and you can definitely insure against those things. But if you are, going down the path of abusing your body, through your lifestyle and food and all those things that you're going to be doing, you are going to pay more than the next guy, and you might be getting into a situation where you're largely uninsurable. And we have to have some kind of program that certainly takes care of the people who have fallen to the lows in society. I'm not opposed to that, but also there is a certain amount of luxury care that we have also grown to expect in our country that is a little bit out of control. You hear some of the stuff, and you're a pharmacist. You can probably answer this. There's so many debates on, and I would love to verify my thought process on this. So I've seen some of the data in regards to insulin. So insulin, at its core, like basic insulin, is fairly inexpensive. And yet what they are arguing about is essentially the primo level high technology, diabetes medicines. And that's what they're saying. Everybody should get the Mercedes, and nobody should have to have or drive the Hyundai. And then they're making it an issue where I think I think, more honest conversations need to happen around some of these things that we're all debating. And I know that's a little bit of a tangent, but
no, that's not tangent at all. I'd love to speak on that.
yeah,
And,
please.
and I've spoke on that hundreds of times. In fact, our #1 podcast, which we did in October 2019, was done on just that, about insulin. And my nephew was diagnosed at like 10 years old as a type 1 diabetic. And I have a twin brother, and he really smart guy, PhD in analytical chemistry. He wanted to, do whatever he can to optimize his son's results. And he ended up realizing that the system is a scam, and those designer insulins are a scam, and that the way to treat diabetes, yes, for all the haters out there that don't want to believe this, the only way to treat diabetes, type 1 or type 2, yes, with type 1, you do need some insulin, but the only way to do it right is with your diet. No
Yeah.
matter if you have type 1 or type 2 diabetes, you have to watch your diet, period.
Yeah.
Diabetes, per definition, diabetes mellitus means honey siphon. It means in Greek, it literally means you are urinating out urine, or urinating out sugar, honey siphon. And so the only way to prevent that, one of the ways to prevent urinating out less sugar, is to eat less sugar. It's a carbohydrate metabolism problem.
Yeah.
So eat less carbohydrates. That's the first, period. Okay. Here's the second thing. So Novolin N, Novolin R at Walmart, insulin, 1,000 units of insulin. It's $25 a vial. Okay. These big fancy, and Novolin N and Novolin R is literally an exact copy. It's called regular insulin. It's literally an exact copy of the insulin that our body makes up. Okay. And Novolin R is actually one of the first recombinant DNA technology drugs. It's actually used yeast DNA recombinant technology versus E. coli, which, kind of a side note, Eli Lilly was the first one that patented insulin back in 1983. Novolin Nordisk came in and found a different way to do it. Eli Lilly used E. coli. Novolin Nordisk used yeast technology to basically make insulin that was a copy of what's in our body, regular insulin. And then they made Novolin N also, which puts a little bit of something on it to help it dissolve a little bit slower, and last longer. So the Novolin N was $20 a vial also. So, hey, Britton, come here. Britton, come here. We're talking about you. Or Finland. I'm sorry. I'll show you. Just happened. Just happened that my get down in the camera. My here's he just walked in, coming across the state. Actually, he came from Idaho. Actually, this is Britton's brother, and Britton was the one that was diagnosed with diabetes over 10 years ago. So, and this guy's a rock star too. So anyway, my brother, who's a PhD in analytical chemistry, Bryce, you'll love this guy. You're a jiu-jitsu guy, right, Bryce?
Yes, sir.
Here. Just flex for him, Shane.
Nice.
Right here, camera right there.
Nice.
Anyway, this is my twin brother, and he with the help of me, also with his son on type 2 diabetes, was able to conquer type 2 diabetes with diet. I'm sorry, type 1. Thank you for and type 1 diabetes through these insulin that he can get for $25 a month, right, Shane?
That's right, and that's also without a doctor's prescription. So
right, that's the key too.
Here's the key.
Yeah.
So when I found out my son was diagnosed with type 1 diabetes, I called my brother. I was very worried. I thought that these kids lived to be about 25 or 26 years old, and so it was devastating to me. And so I called my brother, Shawn, and he said, "Hey, don't worry about it. It's a carbohydrate metabolism problem." Okay, well, I'm a scientist, so and I've always been interested in nutrition. Okay, let's figure this out. So go low carb, right? And so our whole family did at that point. And so then I went to visit the endocrinologist, because that's who they referred us to at the hospital. And so I go to visit the endocrinologist, and the endocrinologist, there's several red flags. The red flags were First of all, he had 2 sons actually who were twins, and also type 1 diabetics, and they were a vegan family, and that was a vegan family.
Bryce, I'm sure you're a vegan too, right, Bryce?
Yeah, he doesn't. You don't look vegan. I can spot him a mile away in the gym.
Yeah.
Okay, so he said he was vegan, and hey, if you want to be vegan, that's fine. But I know that you're going to ingest a lot of carbohydrates also to get the exact protein needs that you actually need. So I knew that was a red flag. And he also said, I said, so what should his insulin requirements be, and what should he eat? And the endocrinologist said, oh, he can eat anything he wants, just take more insulin. And I knew that was a no-no.
Oh yeah.
Big numbers, big variations, small numbers, small variations. And so the more carbohydrates you're going to take, the more insulin you're going to have to take. And there's going to be variability in that. So I fired him on the spot. And he said, well, let's make a quarterly appointment. I said, no, we're not going to come back, doc. And that's when we started using Walmart and just get R and insulin. My son is now 23 years old, studying to get his PhD in chemistry at New Mexico State University. He is more healthy and has a lower A1C than most Americans that aren't type 1 diabetic. And he's very low carb diet. And so anyway, hey, thanks for the opportunity.
And one thing Shane found out right away, and I remember just talking about the healthcare. So Bryce and I are talking about our healthcare system and what a racket it is and how to free yourself from the healthcare system.
Yeah.
Of course, you and I know how already because we've done it. And so the first thing they tried to do, Bryce, is they tried to set Britain up with an insulin pump. And I don't like insulin pumps. I don't, because I know it's a scam. Because they're expensive and drug companies promote them and yada, yada, yada. And so, but Shane was trying to go the route that they were. Anyway, then they tried these designer insulins, right?
Correct.
Yeah. So they tried the designer insulins. Remember what I talked about Novolin R being an exact copy of what's in our body. And Novolin N is a little bit like that, just with something on it to help it basically essentially last longer. So drug companies couldn't patent that. Okay. So they come out with, like lysine was the first one that they came out. And it just not lysine, L-arginine. I can't remember the name of it. Humulin N or Humalog. And it basically took 2 of the protein sequence and it switched 2 of the amino acids around, and it made it act faster. Okay. Well, okay, it acted in 15 minutes instead of 30 minutes. Okay, big deal. Seriously. If you're eating like crap anyway, it doesn't matter.
Right.
But of course, the drug was prescription only. They didn't do away with the over-the-counter stuff. They just made all the new designer insulins that were longer acting and faster acting. They made them more expensive and prescription only. So again, what happens? You have a drug company that colludes with an insurance company and colludes with the doctor. All in this cartel is what happens. So here's my thing. When somebody says, well, how would you treat type 1 diabetes cheaply if these insulins are expensive? First of all, put the fork down. Okay.
Right.
You have hyperactive fork syndrome. Many of them do. Because remember, a lot of type 2 diabetics turn into type 1 diabetics also, because of all the insulin they get.
You mean the reverse, right? Type 1 diabetics turn into type 2
I'm sorry. Type 1 turn into type 2. Yeah. And
I wish that those terms weren't even the same. That is type 1, type 2, because one is environmental, and you can reverse it, and type 1 is not. I mean, we don't know why.
I had a buddy of mine who was pre-diabetic and falling to pieces, and he was a artist friend that I was representing on art tours, and super talented guy. And every time I'd talk to him, we'd have these late night meetings and things, and boom, the Coke was about this big, and he'd be eating crap until 1 a.m., 2 a.m., all this stuff, and his body was falling apart. I mean, he looked terrible, everything, and I finally, just through mentoring him and some pressure and everything. He was a former wrestler. I got him into jiu-jitsu. He got addicted to jiu-jitsu. All of a sudden, he just wanted to eat healthier, and then went on this journey. Now he's a black belt today, 10 years later, and totally got off of all the meds, totally changed his diet, looks like a different human being, looks so much healthier. And it was a process and it was a thing, but he was about to just go down that path of like, well, the doctors tell me I need to do this now, and completely reversed it all. And all these people online, what they're arguing is, and I've lit them up a few times. You just want people to die, and so you're happy that Donald Trump wants high insulin prices, and it's like, okay, come on, get out of here with that.
Yeah.
Well, I think one of the things is what I learned is like pumps and designer insulins that are faster. Now, here's what we know in a free market. I'm also a serial entrepreneur, so I'm a free market guy, just like Shawn, is that people pay for convenience. They do in our world. They pay for Ozempic. They pay for quick loss medical loss, not
bariatric surgery,
bariatric surgeries, all these things, right? So there's a market for it. So you can't blame people for making things that people want, and it's probably going to make them a little bit more healthy, if that's why you want to look at it. Us three here on this podcast can understand that, because it's not good for the long term. However, what I saw was with my son is that a pump or designer insulins or anything that's going to make it more convenient for you to eat is a problem. Yeah. Eating should not be convenient. That's why I don't eat. Eating was not convenient. It never was. You had to go hunt. You had to go dig.
Think about dessert. Okay, if you wanted to, have an apple pie or something,
dude,
like
it took 4 hours.
Food required labor.
Exactly. Right.
And now it requires no labor, and so people are able to just eat like kings, and get very many of the same diseases, interestingly enough. And just absolutely destroy themselves, and that's the and listen, and I'm sure you guys talk about this, but our food industry is complicit in this. The poisons that they're putting in our food, the things that they've done to our food system. There's some great evil there. They're kind of in the same cabal with the big pharma and everyone else. And so I have sympathy to a certain extent for people who are unaware of that stuff, or don't realize they're being poisoned, or got caught up in the marketing push that some of these companies have. And oh no, wait a second, I eat low fat, I eat LITE stuff all the time. I don't understand why I'm obese.
And I limit my eggs. I get 2 eggs a week, and I only eat red meat once a month.
I don't have any. I don't eat saturated fats, and so I don't know why my brain's not working. But
right. No, it's the industry, the big pharma and big food, and you talked about it earlier, Bryce, with the health insurance industry. It's been bought off by the federal government.
Right.
I mean, the FDA is in collusion with big pharma. The FDA could not exist without big pharma. So if we really think that, in our healthcare system, that the system is meant to make us healthier, it should be called a sick care system.
Yeah.
Do you think our system, Bryce, do you think the healthcare system wants diabetics to reverse their diabetes?
That makes them too much money.
No. And look at what happened with Shane's son. Shane's son's a diabetic. He hasn't been to a doctor in I don't know how many years now.
10.
Yeah,
right.
It's useless to them.
Useless. They were literally useless.
No,
in fact,
they want subscription patients. I mean, that's really what they're after.
Yeah. And they would have killed Britain. I mean, early.
Yeah, he would have started getting complications already.
Yeah,
I mean,
sure.
Definitely. Yeah.
Yeah. So
now some of the innovations that they do have can be, we can't knock science and innovations.
Agreed.
And I've seen my brother post about allergy medications and some other things that are just, I mean, I couldn't live without them. I don't know why, but this year my allergies have been really ramped up. And so it's not, I don't think there's an evilness. There's just, it's market. If people decide it's lifestyle drugs, some people don't want to change their lifestyle. And it, like I don't think it's fortunate. It's a good thing. But now my son, he's in New Mexico now, and to get a CGM, which he likes, so he doesn't have to poke his finger all the time, and it gives him more real-time data. And he's a scientist. He geeks out on data just like I do. And it's actually even helped his A1C stabilization further. That is great technology. Now, why does he have to go to a doctor to get a prescription for a CGM?
They're changing that.
Good.
Like soon, very soon.
Good. So is that a federal law or something?
I don't know. I'm not sure.
Good. Because he has to get a prescription to get a continuous glucose monitor. That is dumb.
Yeah, that is. Well, I want to go back to something that you said, though, because I think I don't think we should divorce the market from morality. Because, these are human actors that are making the decisions. And I think we as a culture. And again, I'm a Christian man, and I think we once we became enamored with the idea of rule of law, what we did was we passed, every little bit of legislation that we possibly could, and we continue to do that. And even as Christians, we ask what is legal and not what is moral. And so many of the decisions that are made by business people in favor of what we're calling the market, because they want to make money and they're motivated for that, are still quite evil. And the people are behind it. And so the fact that they think that, they can do what they've done to our food, and there are people that are morally responsible for the decisions that they're making to corrupt our food sources, to destroy our food sources, all that stuff. And I think they should be held accountable. So I don't want to and I don't think you're just giving them a pass or anything like that, but I want to make a special note there that, there are decision makers behind every single one of these things. It's not yet all AI driven.
I'm with you on that, and I do think there's a lot of evil behind it, and that's one of the reasons I believe in the least government intervention, the better.
Yeah,
because in a true free market, in a transactional exchange market, in a mutual exchange market, Bryce, you want to sell me something, I want to buy something from you. I agree on the price, I agree on the quality, I agree on the service. The government gets completely out of that. It doesn't matter what the service, what the product is. It doesn't matter whatsoever. It's a mutual beneficial exchange. When you get a government that makes regulations in between that, then there's a whole bunch of other people that are going to muddy the waters, and it's not going to necessarily be beneficial. For one, Obamacare, like we were talking about, it's not been, the only people it might be beneficial for were the people that truly couldn't afford health insurance in the first place. Although I don't argue that's really true. It's always about priorities, and those
No, and
people
it really hasn't. It hasn't brought costs down. It's only
it has not brought costs down. In fact, you look at my book; it's escalated costs.
Yeah. No, and it really hasn't helped people, and it really hasn't because the even at my client level, it's not that the clients were forced to be necessarily more generous. I mean, there are always businesses that weren't providing healthcare. There's always businesses that, even today figure out ways not to do what they're supposed to be doing, even according to these existing laws. And so it wasn't this just amazing result at any point. It didn't really do almost anything as advertised, and it of course certainly didn't bring the costs down.
Yeah, and let's back up on employer-sponsored healthcare. I don't know if you know the history of it, Bryce. It's in my book, which I gave you a copy. But the reason it came about was because of a wonderful communist president FDR that put wage freezes on wages back in the 1940s during World War II, when he was worried about escalation of prices or wage inflation, because everybody was busy. The war machine was busy, right? And so the only way employers could attract other people was to give them something else. So they came out with hospital insurance, and it was literally first started to cover appendectomies and maybe the birth of your baby or something, not an ingrown toenail or your sniffly nose or your diaper rash.
All things that should be paid for directly by people, and if they were, the costs would come down dramatically.
Exactly. So anyway, that was employer-sponsored insurance. Now here's my argument. I talk about it in my book. It's like, look, I personally, and we don't in our business pay for our employees' insurance, and we make it clear to them that we're not going to, because we don't know what's best for them. An employer doesn't know what's best for a person. The best insurance we have is to take care of ourselves anyway. So what we do as a business is we try to be good stewards and good examples of what good health is, and we try to model that in our employees. I personally would never ever work for a company that wants to give me health insurance. My youngest son is in the process of negotiating with his company right now to give him more money because he doesn't want their health insurance. He's the first person in 40 years of the history of that company that's ever done that, and he's 22 years old, because he knows it's a scam. Why would I want an employer to pay $1,500 a month for something I'm never going to use? Why don't you just give me more money?
Yeah.
That's my
Well,
argument.
I'm in favor of things that are illegal now, and that's actual catastrophic coverages and things that you used to be able to buy. I would love to see come back, because I think those are actually potentially useful. Right? You certainly don't want to lose your life savings if you get hit by a bus. If you can, use a true insurance product to do that, I think those are, that's what it's for.
For sure.
But again, you can't buy that. Nobody can sell it. So it's a shame.
Well, here's what I do know, and you said you're fans of things that are illegal. Shane and I talk about this all the time. The government can't stop free markets. They can't. They never have. I mean, a perfect example is, they're going to tell us what kind of insurance we can buy, yet they can't stop cocaine from coming across the border, or fentanyl. So they can't. You can't stop a free market as much as the government wants to try. They can't. The Soviet Union tried for years. I mean, the price of Levi's in the Soviet Union was $400 for a price of Levi for a pair of pants. But they can't stop people from buying it. The price just went up.
Right.
So, Bryce, as we wind this podcast up, tell us what you have a passion for.
Well, I mean, listen, I'm a pretty deep and interesting guy, in the sense that I've got a million things on my plate. There are things that I have a passion for in regards to hobbies. I'm a longtime jiu-jitsu guy. I've taught for many years. I've trained for, I guess we're going on 28 years. So I'm a 4th degree black belt under the Machado family. I own a Carlos Machado school. And, so that's a great passion. And I think everybody should learn to fight. Your brother's buff, but if he doesn't know how to fight, it might be useless.
Oh, we're both state champion wrestlers. We know how to fight.
State champion.
And let me tell you, Bryce, the history of jiu-jitsu, when Shane and I first saw UFC 1 and 2, this is what we said. We said, you know what? If a wrestler went in there, he would kick the shit out of all these guys. And sure enough, I mean, wrestling dominates fighting sports, period, because it always ends up on the ground. And I get it. Hoist Gracie did very well 1, 2, and 3. Dan Severn screwed up on his double leg in number 3, or he would have beat Hoist Gracie.
Yeah, well, what it was is there was a violence that came with wrestling that, especially the Americans brought to bear. Now, I am also a wrestler, so look out. But I thought that the wrestlers did good. Now, what you have, of course, is you have guys that are wrestlers. They have jiu-jitsu on board. They've got, you now have well-rounded fighters that have a little bit of it all. But jiu-jitsu was the kind of eye-opening moment that let people understand that grappling and learning to grapple is necessary. If you don't have any of that on board, you are not going to win. And so, so it was a wonderful time to have that happen. And so, I've enjoyed that for many, many years, and, been in martial arts and all of that for, decades now. I've got a passion for this country. I'm a patriot. I'm a believer. And I believe that as Christians, we need to be participating in politics. Politics in its simplest definition are just how we organize a society. And many Christians bowed out of that for years and allowed what we created here based on those biblical principles to completely deteriorate and disintegrate, and we're in all kinds of trouble. So my passion for the last couple of years, and my passion for many years to come will be, how do we return to that? I think we created a generational problem, and it requires a generational solution.
Yeah, I'm with you. So, Bryce, as we wind this up, if anybody has any questions, what's the best way to get a hold of you?
Yeah, so I mean, you can follow me on Instagram. I'm Super Bryce Eddy there, or the Bryce Eddy Show. You can DM me there if you have questions. You can go to our website, bryceeddy.com, if you want to sign up for our newsletter or get on the email list for us. You can follow me on Twitter if you want to see me argue with people from time to time. Bryce Eddy 1 if you want to pay attention to the things that we're doing. And I think I post some good content and clips of my show. If you want to listen to the show, we're on Rumble. If you want to see the video, if you just want to listen through the podcast apps, we're on Spotify and everything else at the Bryce Eddy Show.
I love it. Thank you so much, Bryce. You've helped us realize our goal, which is to educate and empower consumers to take charge of their own health. Thank you so much, Bryce.
Amen.
Good to meet you, Bryce.
And thank you, Shay, for being our surprise guest today. That was a surprise.
Anytime. I'm used to the camera.
Yeah, right.
All
right. Thank you so much. Listeners
All
and
right.
viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Wednesday, where Janet and I are going to talk about food, family, and freedom. So thank you, listeners and viewers, for tuning in.
Happy 4th.